I'm now going to do a dorsal restraint. So I'm going to lie Willow on her back, and I'm going to take both her legs, and I'm going to gently roll her so she is on her back. And then this way, she can't move. I have both her front and her back legs, and she cannot get up. And this is a dorsal restraint. So if your patient is sitting down, you want your dog to be laying flat, or if, in this case, if I walked into the room and Willow was laying on the ground, that is great. So I'm gonna go up, and I'm going to take this back leg, and I'm going to put it forward, and then I'm going to lay Willow down, going to grab the leg that is on the floor, the front leg that's on the floor, and the rear leg that's on the floor. And then I'm gonna use my forearm right here from my wrist to my elbow, and I'm going to push that on her neck behind her ear. And what that does is it helps restrain the dog, so then Willow cannot get up if the veterinarian needs to do an exam on the dog. So I would hold this front leg, which is on the ground, up, push down with my elbow. It doesn't need a lot of pressure. I'm just right now resting my elbow on her neck, and then I have her other rear leg that is on the ground, and that holds, I'm going to hold that up, and this will prevent Willow from trying to get up, because when the dog tries to get up, they use the two legs that are touching the ground to push themselves up. So by holding these two legs up, she cannot get up. I'm going to restrain Willow as if we were going to get a blood sample from her front leg. So I would grab her head, and this would prevent anybody that was coming towards her from getting bit. And I would hold her front leg, and I would hold that vein off, hold it forward, and I can either hold her mouth if my hand is big enough to keep her mouth closed and not allow her to bite, or I would come behind the ear right here, and my elbow goes right here on her neck, and I hold her head up, but I want to make sure that her mouth isn't going to bite the person that is coming to do the exam, or she can't reach around and bite me. So I want to hold it where it's going to protect both myself and the other individual that's going to do the exam, or draw blood. So you can see I have a good hold on Willow. She cannot attack anybody. She can't turn her head towards me to try to bite me. And then I would hold her leg like this so that they could draw blood. Or I could hold her back leg and they can draw blood back here. I'm going to do a sitting restraint. So now you can see Willow is sitting down, and I'm going to restrain her like this, holding her head away from the individual that is going to do the exam. She cannot bite my head, she cannot reach around, and I'm bracing her bottom with my other arm so that she can't slide back. And if somebody was going to draw blood, or the doctor was going to do a heart rate, this is going to protect both the doctor and the technician by holding your elbow underneath her chin area right here and bracing her back end with your other arm. So I'm going to put my arm underneath her neck in that same position that I've been holding her for all of our restraint techniques, and I'm going to put my other arm underneath her abdomen area, and this will prevent her from sitting down. So I'm going to hold her head once again like this, up, so she can't bite me or bite somebody else. And then I have her abdomen, and then she can't sit down.